Hi everyone, this is Dr. Merhaut here with Dr. Keklak. Welcome to this week's Elite Education series. We're going to be talking about push-ups. So we'll be going over proper form with the push-up. This is something we commonly see, someone that has a shoulder issue or just weakness in certain muscles around the shoulder that can cause problems. Or we're also going to talk about why you shouldn't be doing a push-up if you're having certain shoulder problems and why that may be. And then we'll go over a couple modifications that you can do if we notice something that's weak and you shouldn't be doing the proper push-up, how you can modify that to still get the benefit of it. So we're going to have Dr. Keklak go down on the ground into a push-up position. One of the main things we're going to focus on right now is the shoulder blades. So the scapula should be flush against the thoracic spine. So when he's in the plank position here, it should be nice and flat all the way through. I'm going to have him go into an improper scapular form or shoulder blade form where the shoulder blades kind of pop out. So if he drops his thoracic spine and I can get my fingers underneath those shoulder blades, that's not what we want. That means sometimes there's a little bit of weakness in the serratus anterior muscle. So we could do some strengthening stuff to get that stronger, and so that's flush against the thoracic spine when we're doing the push-up. So I'm going to have him go down into a push-up just so you can see what the shoulder blades look like as he's going down into that. So if he goes straight down, we've got his shoulder blades nice and flush all the way up, and then you can come back up. And that's typical form of what you should look like. If you also see his spine is nice and neutral in a line, he also has the strong core associated with that. So if we ever see either the lumbar spine dip down a little bit or his pelvis or hips dip down into the floor, that means you're not activating the core properly within the push-up, and that's also a time where you should not be doing it. So if it's a core weakness, one modification would be just going down on the knees like he is right now, as well as if you're having problems within the shoulder blades, this takes less pressure off that area, so you're not having to push as much weight when you're doing the push-up. You can go ahead and get up, Dr. Keklak. Things to talk about with the push-up, why you shouldn't be doing it. If you're having shoulder problems, the push-up is working out a lot of the pec major and pec minor. So with the muscles, they are attached to the shoulder and the chest. So if you're strengthening them, you're trying to shorten those muscles, then that rolls the shoulder forward. So if you're trying to develop a big chest and you're not really working on the back, the rhomboids, lower traps, everything behind that area, which counteracts that motion, then you're going to have the forward rolled posture. And that predisposes you to different shoulder injuries. So if your shoulders are rolled forward and you try to do anything overhead, then it's going to impinge on the acromion process in the shoulder blade. So then sometimes people will develop the impingement syndrome, that pain in the front of the shoulder anytime they do anything overhead. So if you're experiencing that kind of thing, then push-ups may not be the best type of exercise for you. If you are doing push-ups and still have shoulder problems, you want to balance that out with things in the back. So things like rows, lat pull downs, making sure you're activating the muscles that are attaching to the shoulder blades, so the rhomboids, the lower traps, and things like that. So if you have any questions, or if you know that anybody will benefit from seeing this video, or if they have pain in the front of their shoulders or anywhere in their shoulder and they're doing push-ups and it's not an exercise that's working out for them, feel free to share this with them. If you want to hear of another exercise that is problematic, feel free to comment on that, and we can add that into next week's Elite Education series. But I am Dr. Merhaut here with Dr. Keklak. Thanks for tuning in, and I hope you join us again next week.